Thank you very much, Minister. And it's lovely to see such a wonderful crowd here as we are in the middle of the tail end of a hurricane. And I was just saying to Victoria earlier, when I was a small child and was learning to read out loud and in public, my mother always said, talk as though you were talking through a hurricane. So today I actually get the chance to do it. So, August 1918. 100 years ago, we were in a bit of a what was that moment in Irish history and in world history. A mystery disease had come in through the ports and had spread widely, particularly through Ulster and North Leinster. Sorry, Cork. That disease should come back from such an enormous war to the civilian populations was widely expected, a constant warning in the newspapers, because that had been the experience from other wars, like the Prussian War and things that smallpox and things like that would come back into the civilian population. So when it petered out in August, there must have been an enormous sense of relief, and people got on worrying about the war and the national situation and things like that. But it turned out that this was only the first of 3 waves of the 1918-1919 influenza pandemic, which we now know as the most deadly influenza pandemic the world has ever known, and one of, I think, 32 since 1500s when we've been able to count them. The Spanish influenza pandemic, it's called that. People always ask why. It's the first question. It was first reported when Alfonso XIII and several thousand of the Spanish courtiers became ill, and it was reported in the Spanish newspapers. But of course, by then, we now know that the guns of war had actually been rendered silent when the troops were ill with the flu. But wartime censorship prevented them letting it into the newspapers. So the Germans, particularly the Americans, the British, the French, were all their troops were suffering really, really badly from the flu in the spring and early summer of 1918. So Spanish flu, first of all, is a misnomer, but it's still a handy tag rather than calling it the 1918-1919 flu. It spread all over the world in usually 3 waves. Sometimes there was a 4th wave, often in 1920, for example, up amongst the Sami people in Scandinavia, that had to get to more remote populations. Usually it it infected between 1/5 and 1/2 of the world's population. And sometimes in the more remote populations where they weren't used to that kinds of disease, it would infect and kill far more. So you hear people like the Inuit in Alaska were really seriously affected by it. Sometimes entire villages were almost completely wiped out. Originally, after the flu, the estimates were quite low of the global mortality from it. Edwin Oakes Jordan estimated in 1927 at 20 million. The WHO, the World Health Organization, now says that 40 to 50 million died. But given that in recent years we've discovered that added into that number the Indian death estimate of 10 million, the global number is often suggested to be closer to 100 million. But the real figure will never be known because certification was quite new, and cooperation on collating death statistics internationally, something that had begun to happen with the cholera pandemics of the 1900s and also the Great Famine and things like that, promoted the idea that if we could only create some international cooperation about diseases that are flying around the world, we might be able to do something to create quarantines and to create barrier methods or to introduce hit squads to kind of run for it. And ultimately, the flu started off the international monitoring of influenza, given us the systems that we have today. And indeed, we now think that influenza historians and epidemiologists and other researchers now think that the reason the 2009 pandemic is, a damp squib is because it was so successfully curtailed. Do you remember all those long lines of queues where we went and got vaccinated? Unfortunately, again, with pandemics, had that terrible effect on some people who reacted badly to the vaccination. The pandemic really showed the need to improve the collecting of death by disease statistics. In Ireland, it's been very much a hidden history until the 21st century. Americans would know well their flu history, whereas here we don't. And indeed, it was really well covered by the newspapers, and at the Times they were absolutely full of it. As flu would hit a town, the provincial newspaper would cover it, or the national newspaper would cover it, and then when it went away again, you'd know because they'd be talking about the war or the national picture instead. Really well covered also in the death certification collected by the Registrar General. Afterwards, historians, I suppose, their gazes were kind of entranced more by covering the war and revolution. And also I think that we've now changed to a different style of history. At that stage, we were much more concerned with political and, I suppose, military history of the war. And now we're much more interested, even in terms of the war, in the kind of social history of war. There's another reason, I think, why we know so little about it. And I think that disease was just so much a normal part of human life. And 20% of the annual deaths of the 70,000 or so on the island of Ireland each year in the 1910s were children under the age of 5. And I just think that's an incredible statistic. So disease touched most families, and sometimes often. So when this other disease, it's just one more noise in a cacophony of diseases, in a way. Like with our backward glance, it looks enormous. But in fact, when you have 7,000 or 8,000 a year dying from TB, 4,000 or 5,000 dying from bronchitis, 3,000 or 4,000 dying from pneumonias each year, and then 400 or 500 a year dying from measles. What's this disease that kills 20,000 or so? So perhaps, too, the other thing I think is that perhaps the reason it's forgotten is it didn't need to be used by the nationalist movement, who had very quickly adapted it into their propaganda material. When it was over, we were very firmly onto the path to independence. The first Dáil had been set up in January 1919. The flu didn't end until April 1919. So maybe that was another reason. It didn't need to be adapted into the kind of national tragedy story about the nasty things the British did to us. Over the 2 years, and intensified into 3 waves in June, July 1918, then October through December 1918, and then February through 1919. That was the peak weeks for death and for spreading it around. There were 20,057 certified flu deaths. There's about 3,000 excess pneumonia deaths by taking, an average over 10 years, over the previous 10 years, and seeing how many more people died from pneumonias. In my estimate, about 800,000 people catch the flu, and that's about 1/5 of the population, which was about 4 million at the time. And that's if the case fatality rate was 2.5%, which is a broadly accepted rule of thumb, that 2.5% of those who actually catch it die. And you read an awful lot of nonsense about the amount of people that die. I've heard people say that 3% of all the people in Britain died from the flu. That's just not true. It's 2 or 3% of those who actually catch it. But the evidence suggests that many deaths were not certified as people were dying so fast. So you have doctors working around the clock, maybe 18 hours a day, as some of my evidence suggests. And they're too busy treating the living to try and keep up with the paperwork. And this is something that the Local Government Board for Ireland recognises in their annual reports. They're dying so fast they can't count the numbers. So that 20,057 or 23,000 is just a broad guideline number. But what it does suggest is that it's roughly on a par with each of the cholera epidemics that we experienced in the 19th century. And we're far more familiar with them than we are with the idea of Spanish flu, or at least we were until recent years. Leinster and Ulster were most severely affected. Kildare has the highest county death rate. Dublin and Donegal were also severely affected. So let's just go to the maps and talk about why. But first of all, out of sequence slide. This is the Irish Independent on the 26th of October 1918, really at the peak week of the flu, which would have been that week and the following week along the East Coast. This is the kind of front page story that you'd see. I apologise, it's a little bit blurry. But you see the main stories of the flu there. A virulent epidemic, worse for several generations. Scarcity of doctors. A lot of the doctors were away at war, so that meant there was a shortage of doctors. demand for the release of interned men. Ewan mentioned earlier the German plot. There was a lot of three doctors who were tied up with that, and they were interned in England, and church prayers ordered. So this is the rate of death by county per 1,000 head of population in 1918. And you can see that here it's coming in, and this is what I spoke about, the first wave. This is the first and second wave, obviously. So it's here all along the coast here, and again down in Leinster, Dublin. And for some reason, Meath doesn't have a very big experience of flu at all. And I think that is possibly because it doesn't have a very dense railway network. But Donegal is a constant puzzle to us flu historians because it's affected badly across the 2 years. And then Cork, on the other hand, you can see here, 1918, not very badly affected at all. And these are actually a twin pair, because Cork has from when America enters the war, it has the US Navy stationed off Cove, and in Donegal they have the Navy, the British Navy up with Jellicoe's Navy or whatever, up stationed in Lough Swilly. So Ireland is in the middle of kind of two shipping lanes across the Atlantic. And these are waiting here, top and bottom, ships waiting in both of those places to escort troops in to other parts of Europe. And they're kind of waiting there. And after a lot of toing and froing and talking to people, we've kind of come across, myself and Patricia Marsh, another flu researcher, is that the ships in Lough Swilly, when the troops got flu on them, they were generally taken into the civilian hospitals and treated. Whereas in Cork, the US insisted on treating their flu patients with on board. So I think Cork was saved quite a much worse experience because that actually happened. And I've actually had an eyewitness. I interviewed a lady who was 107, and she'd been a 15-year-old when she got the flu, Kathleen McMenamin. And she spoke about the troops coming on board, spreading flu around Rathmullen. She was from Rathmullen up here along Lough Swilly. So she told me that was something of a puzzle solved for us. Oh, there. So you can see here then that the flu spreads broadly westwards in 1919. Again, Donegal particularly badly affected. It moves to Mayo. That may be something to do with seasonal labour. And then down here, this peninsula is much worse affected. County Clare, I think it's 49 deaths in 1918 and a little bit less in 1919. And again, I wonder if that's something to do with the inefficiencies of the West Clare Railway. Are you right there, Michael? So sometimes lack of technology can be a good thing. All right. This is the flu deaths by province. Leinster here on the left, which in terms of simple numbers has the second highest experience. Ulster, with a slightly bigger population, has the worst experience. And then this is Connacht, and here we are in Munster here. And again, the red bar is 1918, the yellow bar is 1919, and the black bar is the total. And if you reverse that by head of population rather than simple numbers, Leinster actually has by far the worst experience. Cork in the 1918 flu, I couldn't leave that out, even though the numbers weren't as high as they were in my now home of Kildare. The county and borough had a population of 392,104 in 1911. 352 men and 243 women died from the flu in Cork in 1918, a total of 595, giving a death rate of 1.51 per living population, which isn't quite as low as County Clare at 0.46 per 1,000 living, or Kerry at 0.94 per 1,000 living, but lower than Limerick, which is always a problem for infectious disease, 2.43. Louise mentioned that earlier, I think, about the tenements. They're giving issues with health. And Tipperary and Waterford, and much lower than the county death rates in Dublin, 3.7, and in Kildare, 3.95 per 1,000 living. In 1919, Cork loses 463 men and 363 women, a total of 826, obviously a higher death rate of 2.11 per 1,000 living. And flu has essentially spread westward in this third wave period. We only have specific, weekly death rate numbers for Dublin, so I apologise for giving Dublin rather than Cork. But this shows the 3 waves in the spring, by week in the May and June of 1918, and then in the autumn of 1919, and then here in the spring of 1919. Stuck now. And this is the death rate from influenza in Ireland in 1918 and 1919, classified by age group. A particular feature of this flu was that it hit young, strong, healthy adults. It seemed to attack those with a very strong, healthy immune system. It caused a thing doctors suggest called a cytokine or cytokine storm, where the immune system would begin to attack itself, and people who got that condition, and indeed that happens now with some influenzas even today, but the very high killing avian influenzas that would kill maybe 50% of those who catch it. So you can see here these 2 groups here, the young healthy adults. So that means one particular thing, that it is parents of young families. And that is one of the big tragedies of this flu, is that a lot of parents were killed. And that had ongoing effects going forwards on their families. And then, as per usual, children under 5 died in their droves. And when you see some of the ledgers of the lists of the dead, the certification by the Registrar General, your heart just breaks when you see street after street of children of 1, 2 and 3, sometimes 3 and 4 children, maybe more, from one family dying. And they're all forgotten. So in a way, I like doing research like this because at least you're giving them back something of a life. Sorry, just trying to get... This is the peak week of the flu in Dublin, in the week ending 2nd of November 1918. Again, you can see the numbers of children under 5. Sorry, going forwards. The numbers of children under 5, there was 100 out of the total number of deaths died that week. And again, this group, 25 to 35-year-old age group, very, very badly affected. And this is the deaths in Dublin by social class and occupation in June 1918 and June 1919. And the bottom class here is the class number 1, like that would be kind of bankers, aristocrats, people like that. And then the next classes are merchants and things like that. And then this is the 4th class. And that would be like Louise's domestic servants and postal workers, policemen, people like that. They were very badly affected. There's a very interesting thing here which was pointed out to me by a demographer. And this is this inversion here in the highest class, in the class number 1, in the peak weeks of the flu. And you can see it again here. And that suggests to us that your aristocrat or your landowner or your high-ranking banker or whatever is sending somebody out to do their messages for them. And they're dying rather than the elite. How are we doing time-wise, Mike? Okay. So who is most likely to die by age groups? I've mentioned the adults, 20 to 35, because it attacked people with strong immune systems. So the newspapers and my book, which is available in the shop for €31, not to be outdone by Louise. It's called Stacking the Coffins, and you can't miss it because it's white with a black coffin on the front of it. It had stories about lots of Irish sports people who died. There was a guy, Joe Ross from Louth, who was a very prominent GA player and cyclist. He died from it. But in every county, in every newspaper, you will see stories of boxers, of GA people, and lots of those who died. And indeed, the All-Ireland hurling finals and football finals were delayed because teams were so weakened by the flu. And my own currently beloved Kildare, I'm from Wexford, but I've kind of adopted Kildare, reckon they lost, they got the first All-Ireland in 1919, but they should have really won the 1918 one, rather than my native Wexford, who got the 4 in a row as a result of that, which Kerry have never been able to beat. Another reason why I think that adults may have died, partly the immune system, but partly that because social insurance was so poor, that they may have had to go back to work to provide for their families. And indeed, I've interviewed a few people that I'll introduce you to later who did that, and their relations died as a result. Older people seem to have some protection from it, perhaps acquired from an earlier similar flu, but not the previous pandemic, the Russian pandemic of the 1890s. I think it was one around the 1870s. Statistics and newspaper reports shows us that death from flu was much more likely to happen in families where the breadwinner dealt with the public. So while poverty and the quality of housing, particularly in the tenements of Dublin and of Limerick, is a major factor, even within similar housing conditions, the job plays a role. So all types of shopkeepers, the shop workers, and this I saw particularly in the Kilkenny papers, where your politician friend, his grandfather, Mr. Hogan, his grandfather died from the flu. Yeah, he was an auctioneer and he died from the flu. Also Phil Hogan. Also, all types of shop workers, whether owners or the counter hand, the police, doctors, nurses, postal workers, ambulance service, newspaper people, an awful lot of journalists and printers died. Prison warders died in droves, even though, in fact, the prisoners themselves were very protected. Only one prisoner died on the whole island of Ireland from the flu, a female prisoner in County Derry. Priests, you see priests frequently dying for it. All were much more likely to die. Domestic service, Louise, they mightn't have been protected from the gentlemen of the house, but they were protected from the flu. And the rate of death amongst domestic servants is one of the lowest right across the board. It's a really interesting statistic, probably because they were basically never got out. You know? They had, a half day or something, and then church and Sunday. And the very poor, people dependent on casual labour in those awful tenement conditions where obviously diseases spread like wildfire, they were much more likely to die. Housing conditions, money for food, heat, medicine, all a factor. And I wonder too, often when I've interviewed lots of doctors talking about the tenements, particularly in Dublin, and they talk about the ends of, the windows having no panes in them and the sides of the houses coming apart. And we really can't imagine that kind of housing now. But I wonder if smog also played a role, because clearly if you have flu and then the smog comes in, and Dublin in particular was a really dirty city at that stage. So entire towns and villages silenced as it passes through. You see reports of just everything in the building in the town is stopped, that the public buildings are closed, the schools are closed, shops are doing very limited service, the courts are often closed or suspended for a little while. You'll hear reports of the hospitals being filled to capacity and of struggles to put in more beds and, to turn more vacant rooms in various kinds of hospitals to accommodate flu patients. D.W. McNamara was a young house doctor in the Mater in Dublin. He'd just begun working there when the flu broke out. And he talks of the hospital there turning over most of the wards to treat flu patients, just keeping one ward for female and one ward for male medical surgery. And this was replicated in hospitals and workhouses. Most people had to be treated at home, as you could imagine, like the health services. And indeed, Minister, I would think you would agree they couldn't cope today any better than they did then. But you will hear of, I particularly focused on the newspapers in Leinster when I was doing my PhD, and you will see a small town like New Ross will have 1,000 people sick and under medical care, which I can't imagine being actually able to be done today. The Houghton and Hospital and the two other hospitals were completely full. I think Dundalk had 4,000 sick at one stage. Naas, which was a tiny town with maybe had 1,000 people, like nearly half the population, under medical care. This is replicated all over the country as it passes by. So you get a lot of help coming in from the neighbours, really, is what we relied on for surviving. And one of the things I have to keep reminding people is that while we lost 20,000 plus people, 800,000 caught it. So an awful lot of us survived, which is great news for me because I got to talk to quite a bit of them, maybe 100 or so people who survived the flu. In 1918, the Poor Law medical dispensary system covered 70% of the population. That's how many people were under its care rather than availing of paying for their own care. And it was controlled by the local government board for Ireland, which was here in the Custom House. And then locally by their local agents, the boards of guardians who managed the unions. And it was a very fractious relationship in 1918. And the boards of guardians, you can see constantly through the newspaper reports, because unfortunately the local government board records were burnt by those so-and-so revolutionaries who destroyed most of the things I'd like to look at as resources. The boards of guardians were increasingly nationalist, whereas obviously the local government board was an agent of the state. And the local government board really did nothing to manage it. They just left it up to the boards of guardians, and they just kind of ambled and wommassed through it, and you don't see any great announcement about them at all. So when that happened, local authorities, voluntary bodies, and the neighbours kicked in. The local authorities were vested with certain powers under the Sanitary Acts to do things like closing buildings and to sanitise the streets and things like that. Many towns, including Dublin, were disinfected streets daily in the peak weeks. Public buildings were disinfected. Cinemas banned children from their showings. Schools were closed. Cinemas then would leave a gap between showing to clear out to try and reduce the germs. Community groups, I particularly heard of them. If there's any in Cork, I'd love to hear of them. Dundalk, Naas, Athy, Clonmel, Borstal, fed and nursed the ill. What they'd do is get in people who would make big pots of soup, and then the local good ladies of the town would go around in their horses and carriages and deliver them to the ill. Because when entire families would be sick, they couldn't get out of bed to go and feed themselves. And don't forget also that in those days they didn't have the kind of home medications that we have that are so reliable today, like paracetamol and stuff to reduce fevers, and so that would add to the burden. Women's National Health Association, St Vincent de Paul, would be do it. Landlords also organised soup and stew drops for the needy, and Turtle Bunbury's, I think, great-grandfather, Lord Rathdonnell in Rathvilly, would have sent down soup to the people of Rathvilly, and Lady Barton and Straffan went around in a carriage bringing soup and stew to the locals there. This is heliotrope cyanosis. This was a sign that was regarded by doctors and patients and family alike with dread. It's when the alveoli, you can close your ears now if you have a sensitive nature, the alveoli, the little sacs and air sacs in your lungs, fill up with pus and whatever else was in it that was created by this flu. And your body can't oxygenate your blood because your lungs are not working properly. And few people, once you develop this kind of symptom, few people actually recovered from this. So doctors threw everything in their medical bag at it. They'd use generally something. They couldn't agree on what to use. So you'll see long discussions in the Royal Academy of Medicine's reports saying, well, I always use, different doctors describing what they used. And one would say, I always use something to reduce temperature. And that was usually quinine. So I'm getting quite fond of my gin and quinine tonic. Quinine had very serious effects in large quantities. And actually, Arthur Griffith, who was part of that German plot internee, he was swallowing bottle loads of it, so much so that his fellow prisoners thought he might die from the cure rather than the disease, because his eyes were popping out in stalks. And I wonder if that had a long-term effect on his health, because he did die from arterial damage. They would give something to reduce headache. You hear quite a lot of reports, I heard from the Poor Law Hospital in Dublin, which is now St James's, of people beating their heads off the wall because the pain was so sore. That was the only thing they could do to relieve it. And Nellie O'Toole, who I interviewed from Rathvilly, said that her brother was doing that, and that his forehead was just covered in lumps because he was trying to get rid of the pain. They'd give something to promote sleep. That was usually Trianol, which I think is an opium preparation. How are we doing, Michael?
Fine.
Okay. And something to open the bowels. And I think the reason for that is doctors at the time were absolutely obsessed with opening the bowels. But if you have a patient that you can do absolutely nothing for, if you can make them get up and run to the toilet, even though it's particularly horrible for them to have to do it, it kind of is confidence inducing. It was a thing called mercurous. Mercurous chloride. And in big quantities, it can do things like making your teeth and your hair fall out. It was pre-antibiotic. Antibiotics didn't come into Ireland until the late 1940s, and when you see a massive change in infectious disease after that. So there was nothing effective to treat the resultant pneumonias. A lot of people told me about, Tommy Christian, a guy I interviewed in our talk, told me about having poultices put on his chest. And he said that gave a lot of relief. And you can imagine, poultice was in this case, was paste of linseed in hot water, put between two sheets of cotton and and it was supposed to clear your chest out. Whiskey was very widely used, and this is something I will always have in my medicine cabinet after doing this research. And some doctors even today tell me that it would be much quicker to work than antibiotics. And they've also suggested, some of the people I interviewed talked about the relations, keeping other relations who were in that particularly exposed age group, the kind of young adults, that they would keep them constantly mildly drunk, and that they survived that way. And the doctors tell me that this actually has valid science in it, because it would prevent the cytokine storm, because it would lower your immune system. And think it's a nice story. And some doctors, and particularly D.W. McNamara, said it was as effective as anything. D.W. McNamara said the older doctors in the matter in Dublin prescribed brandy and whiskey in copious quantities. He said he wasn't quite sure what it did for people, but at least it made them happy, and they had a merry dance to the hereafter. So generally, people like Charles Cameron, who was the medical officer of health for Dublin at the time, he was often sought out by the newspapers. Journalists were really good at campaigning and at going out and finding out, oh, this has been done in London, this has been done in America, and why aren't we doing this here? Why aren't the people in the Custom House doing something about it? So they would be putting in recipes, and one I particularly remember was an MP in Westminster, who was also a pharmacist, posted in the Daily Mail a recipe which was a gargle with creosote. Which I think is really nice. I think I'd rather die from the flu. But good nourishment, plenty of liquids, and good home nursing were reckoned to be the best success. And this poster, which was from W.K. Hazelden, did in the Daily Mirror, Hazelden's cartoons are on the British Cartoon Archive, well worth a look, because he's really, really interested in the flu, because his father caught a very bad dose of flu during the Russian pandemic. So it's telling what the doctors tell us about the flu. Keep warm, keep your feet dry, syringe your nostrils, wear a mask, gargle often, take your temperature frequently. So this expresses the kind of medical puzzle that they're just throwing everything at it to try and keep it done. Another treatment that D.W. McNamara said they used in the matter was a camphor in oil injection, which he described as the very nadir of therapeutic baloney. So bacterial laboratories, we were at the time, bacteriology was the new wonder child of science, and they thought it could solve all the issues of infectious disease. And here came this disease that totally confounded that idea, because at the time they didn't yet know, they hadn't yet had it confirmed that influenza was a virus. So a lot of the bacteriological laboratories around the country are busy making vaccines. And when you look at the contents of those vaccines, they're containing things like streptococcal, pneumococcal, micrococcus catarrhalis. These are all bacteria, so they're not going to stop you getting flu. But what an immunologist in UCC, Anne Moore, has told me, and some other people, is they might have prevented you getting subsequent pneumonias. It was thought at that stage, a lot of people thought that flu was caused by a thing called Pfeiffer's bacillus, which they understood the 1890s pandemic to come from. Pfeiffer was a bacteriologist and was named after him. And that's actually Haemophilus influenza bacteria. So if you were vaccinating with that, you might prevent subsequent HIV infections. So it might have, did they do harm or did they do good? We don't know. But you'll hear a lot of people saying that Kathleen Lynn saved thousands of lives. I'm not sure about that, because she was in fact vaccinating people with bacteria rather than with the influenza virus. Other treatments, eucalyptus was widely used as a prophylactic. In some unions or hospitals, you see this particularly in Ulster, where alcohol was not permitted as a treatment. Some of the doctors used strychnine, an injection, and our generation thinks that is the, James Bond's assailant's weapon of choice for death. And but apparently, again, like that idea about making the bowels move, that it made people get vital, that it made them jerk and things, and people thought they were better. Then there were a lot of snake oils. You see things like phosphorine, which were, the year before would have been talked by saving people from war nerves. Suddenly it became a cure for flu. Oxo and Bovril ran out of bottles because there were so many people trying to fortify themselves with it. And people were also given gruel. A guy I interviewed, Tommy Christian, said, we were given this gruel. He said, what would that do for us? Oh, jeekers. He said, you know what it would do for us. And by that he meant also it made you go to the loo. So, there's this obsession again. Vicks Vapor Rub was available in Castletown Bear. because Americans in, it's gone, I can't remember, but there was a big Castletown Bear colony in the Midwest. I'm trying to think of the name, mining town. Butte, Montana, that was it. So they had a supply of Vicks vapor rub was sent from Butte, Montana down to Bear Island, and so they had it down there when it had run out in New York, which I really like. Influenza became involved in national politics very quickly because I think I've what about 10 minutes left or?
Keep going, I think.
Okay. It became involved in it's exactly the same contemporaneous with the German plot affair. German plot affair, they're taking away those 72 guys that Union spoke about in May 1918. They're eventually released in March 1919. And just before the general election, that pivotal general election in December, Richard Coleman, who has been out in 1916 and been on hunger strike with Thomas Ashe, he dies in Usk prison. And there's more about that in the book. I'll let you read it from there. But this was an ad Sinn Féin took out on the front page of the Irish Independent just before the general election, and this is why they died. So they have a long list of traditional Irish martyrs, starting with Brian Boru and going right down to Richard Coleman, who they're now blaming, the British for as part of the Sinn Féin propaganda because he's died from flu in a British jail. And then on the 6th of March 1919, this handsome young man, there's a vast correspondence in the National Library from women writing in these very romantic letters to him. He has recently been elected an MP for Tipperary East, and he is in jail also. He's interned also in England, and he dies from the flu on the 6th of March 1919. And again, like Coleman, he has a massive patriotic funeral through the streets of Dublin, and then down to his home place in Tipperary. He dies in Gloucester. I've interviewed about 50 people that I could call proper flu interviews, or repeat interviews, collected between when I started my PhD, when Ewan let me into the history course in Trinity. Thank you, Ewan. Between 2006 and now. And now I'm mostly collecting people who have familial experience. Rather, obviously, most of the people, because it's 100 years ago now, have died who can actually remember it. And memory of this disease and of the emotional impact it made on Irish families gets more and more interesting with time. And I know there are people in the audience who have already told me about the long-term impact of this disease on their own families. And I'm most grateful to all those who share their unique part in this global story, and I'm just hoping more of you will share them with me today. So it plays a massive effect on the lives of the individual patient and on the families who suffered loss or permanent disability, because you could be left with heart disease or lung disease of loved ones. And nowadays, whereas 10 years ago when I began collecting the interviews, people didn't really know much about it. They might know, Daddy was a bit sick, and he did talk about having a terrible disease. But now, because of the awareness of the pandemic through Scary Stories in the History Show and people like me writing about it, and Ronan doing stuff on it in the 1918 supplement as well, Ronan. I have an article in that, which they're somewhere around the room, Ronan, I think. The Irish Times 1918 supplement is here, and there's an article in that on it. So more people are aware now about the disease and about the impact in Ireland. But we still don't know, we're never going to know, because we haven't got sophisticated enough statistics, how many children became orphaned, and many were. And for some, life was never the same again. So let me just quickly introduce you to some flu people. This is R.B. McDowell, who was a famous and very eccentric junior dean in Trinity. And he was my very first interviewee. And I think the reason he was very famous and very eccentric was partly because he developed an extreme interest in his own health, I suppose. I was going to say paranoia, but that's not the right word. And this picture was taken for the Trinity Times in August 1918. And as we feel the heat here now, every time you met RB, he was wearing a scarf and an overcoat. And I think it was his early tussle with flu that made him so aware of his own mortality and how damaging a disease like flu could be. And indeed, when David Dixon introduced me to him, he said, whatever you do, don't ask him how he is. And I've been a well-reared young girl. I stuck out my hand and say, how are you? And they said, well, they tell me I'm very good for a man of my age. My blood pressure is... and proceeded to tell me that. But he lived until he was 97. I'm just sorry I never asked him, was the reason that he always wore that clothes, because I'd like him to have actually confirmed it. But what he did say to me was, he caught the flu as a 5-year-old in Belfast, and he said that he's considered to be an invalid for a long time after that. And he said whenever he wanted to get out of something, and just say, a terribly bad cough today, and they'd let him away with it. And he said the other thing was that a lot of jobs that would have been traditional for his upper middle class family were completely closed off to him. He said definitely not the army. And he said, and the bar would have been far too strenuous for him. And so he went into academia instead. And I don't think it's a choice he would have made today. This guy, Tommy Christian, I mentioned him earlier, he was a remarkable witness. He caught the flu, he was born in 1913, and he lived along the canal in County Kildare. And he caught the flu at the age of 5 in January 1919. He could remember exquisite things, like he'd say the clock was beating and each bit of it was pounding into my head when I was sick with the flu. And he said then he described to me the doctor coming at 3 o'clock in the morning, the local doctor from the dispensary in Kill. So that confirmed to me pretty much that doctors were working around the clock. And then he said, then the doctor got sick and we were jiggered all together then. And he said, because the district nurse was about 90 and she could only come around on a bicycle. About the 4th time I'd interviewed Tommy, he suddenly associated his mother's death with it. He said, I never think she was right after having the flu. And she died about a year later. And he thinks she had some sort of heart damage from it. But unfortunately, the death statistic, there is no death cert for her, so I can't absolutely confirm that. But his memory is right in everything else that I've tried him on. He could remember the name of the local school teacher, could remember the name of the local doctor, even the kind of car he drove. Obviously, the time of the night he came, he was the one who told me about the poultices. So I think it's fair enough to take it at his word when he says that his mother died from it. And that had a really long-reaching effect on his family, obviously, not least because his father remarried very quickly after, and he and his sister weren't part of the new family. They stayed being minded by an aunt. And trivia, he had his first taste of whiskey punch as a 5-year-old, and it was a taste that stayed with him all his life, because he invited me down to the pub so we could tell his story. And this beautiful young girl was Catherine Moore in Heatley. She's typical of the face of the war. Her husband, Charles, died at the Battle of the Somme. And her family knew where his body was because he was blown to bits over the Somme, literally blown to bits over the Somme. And he's on the Thiepval Memorial, so at least they knew where he was. But they didn't know what or why their mother had died until their grandson, her grandson, Fred Heatley, came to me and said, do you think it might have been? So we found, first of all, her death cert, which confirmed that she died from influenza pneumonia in November 1918 in the Liberties in Dublin. And then Glasnevin had at that stage developed its record so we could actually go and find her grave. And it's now on the Glasnevin tour. So after all those years where they never knew where the body of their grandmother, of Fred's grandmother and his father's mother lay, they now know where it is, and they go every week and remember her there. And he says that's an enormous source of solace to him because it was such a puzzle and such a sad thing for them. And her grave is now in the Glasnevin tours. I think she's in the supplement as well, isn't she, Rona? This is Stella McConnell Larkin, who's James Larkin's granddaughter. Stella I was interviewing about another thing about actually during the lockout, and she told me of her mother's family, the Moores, who came from a tenement at 34 Marlborough Street in Dublin. And her mother, who later went on to become the wife of Dennis Larkin, who became Lord Mayor of Dublin, a very famous person, very interested in rehousing the poor of Dublin. Anna Moore, as she was then before she married Dennis, was the third of 10 children. She was born in 1909, and she was the only one to survive over the age of 5. And so with the help of the civil registration and the Glasnevin cemetery records, I've found that 4 of the Moore children died from the infectious diseases that were so common between 1911 and 1918. Infant diarrhea, which really scooped up any year there was a heat wave. It would have been enormous this year. Measles, and in November 1918, 4-year-old Mary Moore died from flu at the height of the second wave. And Stella has this marvellous story that was handed down to her by her grandmother of the little girl who was believed to have the gift of sight, saying to her mother, that grandmother, Stella's grandmother, could you please put on my best dress? They lived in a one-room tenement, because I feel something very important is about to happen. So she puts on her best dress, climbs into bed and dies. And she was 4 years, I think, and 11 months old. And like most children, once they got to the age of 5, for some reason, seemed to survive. You know, so she was very nearly out of that danger age for infectious diseases. Stella's testimony made me much more aware of the kind of syndemic disease environment in Ireland at the time of the pandemic, which I think is a very important background to why we don't remember so much. Let me just finish on this guy. The typical victim, as we know, was a young adult, aged 25 to 35, working with the public. This is a story that shows how much it's hidden in all our families. This is the grandfather of my best friend, Anne Burke. And it's a story that we've kind of patched out together over the years, over the last 10 years or so, since I started researching. And again, it's the availability of online statistics that's helped us to develop. You know, it's a wonderful tool for all of us researchers in the room who can patch out our family's history stories. James Delaney was 28. He worked as a Dublin military police constable in Lad Lane. He caught flu in December 1918, got better, and went back to work. And he died from influenza pneumonia on the job in January 1919. And his wife, Margaret, here beside him in the wedding picture, had to become the income earner. And the trauma of his death impacted on more than one generation. Even today, when Anna's talking about it, she talks about the huge impact it had on her father, Dennis, going forwards. Dennis particularly had a terrible fear of anybody in uniform. And we reckon between us that it's because that knock on the door that came when the DMP came to the door to tell him that his beloved father had died. And showing how much part they were, so much part of that generation. He had only one sister at the time, a beautiful little girl. I'm sorry I don't have a picture of her. She had beautiful blonde ringlets. And she was just born the year her father died. And she died in 1923, I think, from scarlet fever. So here he'd lost everybody, bar his mother, and even his mother had lost for a time because he was sent away to be minded by relations while she set herself up as a baker on Kimmage Cross Road and earned a living. But it had an impact on, Anne has told me the longer stories in the book, and I won't tell you all about it here because I have to leave some of it for you to read. But they talk about, she talked about the impact it had on her father's mental health going forwards, and also about how his own family minded him. They wouldn't let him play Gaelic games or rugby or anything like that. They just about let him play cricket. So he was literally wrapped in cotton wool and cosseted. So much so that when it came to having children himself, he wasn't too keen to have too many in case, you know, there was an issue there as well. So the trauma of his death impacted on more than one generation. So let me just end it there, and that's just a little glimpse of the advanced copy of Stacking the Coffins. And thank you very much for listening, and I'd love to hear your stories if you have any.